Senator, it's good to see you. We want to start with this coronavirus relief funding. You're all negotiating there. Senator Coons says he's hopeful we'll see a deal by the end of the week. How likely do you think that is?
I think it's pretty doubtful at this point. It's been frustrating as we've gone through the process. Democrats have been pretty strong on trying to be able to deal with what they call the HEROES Act. It was a $3 trillion bill that the House passed a couple of months ago, that even when it passed, there was a lot of comments saying this is a messaging bill. Well, now they've sunk in pretty hard in saying we need to spend $3 trillion. In fact, in the last 24 hours, they've said, no, actually, we need to spend $4 trillion in total amount. Give you an example, the last 4 bills on coronavirus combined is less than $3 trillion. And so there's a lot of concern on just the price tag, what they're trying to put into it. They want to do almost $1 trillion just to state governments. Again, to give the actual dollars here, every state combined across the entire country, their total budget for a year is $1 trillion. So this would be suddenly the federal government, taxpayers, paying state budgets for the entire country all over. And so there's just a lot of concerns on the dollar amounts that they're looking for and the way they're trying to be able to do it. So we're hoping to be able to say, everybody take a deep breath. Let's focus in on the things that need to be done, and let's actually work on the areas that need to be done, not just a long wish list of things that would like to be done.
In that spirit, what do you hope we'll see in one of these bills? What would you like to see done?
So I'd like to see us stay focused just on COVID-19. The plan that came from my Democratic colleagues, a third of the spending are things that are not even related to COVID-19 at all. We want to say at least focus just on COVID-19. Increase funding for vaccines, increase money for testing. We're way behind on testing still. Even though we spend billions on testing, there's more that needs to be done to accelerate that process. Trying to be able to help our kids get back in the classroom. There will be additional expenses for schools when they go back in. So helping schools that reopen, trying to be able to get additional assistance to them. The small businesses, small nonprofits are still struggling to be able to survive in this. So if their revenue is significantly off from last year's revenue, trying to get them some assistance to be able to get through this year. But there's ways to be able to target it. The challenge that we have is, just like the virus doesn't affect everyone the same. It's the same in the economy. Some people are dramatically affected and their businesses are dramatically affected. Other people, literally their business is higher this year than it's ever been. So we need to be able to make sure that we're using other people's money, that's what tax money is, in the most wise means possible.
On the health front, do you think the Senate bill, Senator, goes far enough to fight the spread of the virus?
It does. It does a significant investment in vaccine, and that's the primary issue that we've got to be able to get, is to actually get therapeutics to be able to help treat this, or vaccine to be able to help fight it off. That's the key thing, remembering always this is a health issue before it's an economic issue. It does additional assistance to hospitals, to people that are caring for those folks, also to schools. But the primary issue that we've got to be able to deal with is how is it being spread. That's going to be tracing, that's going to be testing, and then getting to vaccines, and we have a very significant investment in that.
So, Senator, you recently tweeted that nonprofits have really stepped up to help during this pandemic, and now you've actually put out a bipartisan bill to, in some way, help return that favor. Tell us a little bit about that.
Yeah, we have 3 safety nets in America. We have the family, obviously, is the first safety net for every individual. Then it's faith-based nonprofits and nonprofits across the country that are the second safety net. And the third safety net is government. We've got to be able to make sure that families stay strong through this time period and that nonprofits stay strong through this time period. You just had Chris Coons on. He and I are actually partnering together on this, one Republican and one Democrat, to be able to say what can we do to incentivize Americans giving to their local nonprofits. The CARES Act that passed in March, he and I worked together to do a $300 deduction for every person that will donate $300 to a nonprofit. And our encouragement was to every American, even if you don't itemize your taxes, you'll get $300 off of your next year's taxes if you'll donate to a nonprofit this year $300 or more. That was just an encouragement. A lot of nonprofits have seen the strength of that. Chris Coons and I are trying to be able to accelerate that and do a much higher amount for the next bill as well, saying we've got to make sure those nonprofits stay strong.
It's so nice to see that bipartisanship. Senator James Lankford of Oklahoma, always good to see you. Thank you very much.
Good to see you as well.